Ardern.
Thank you, Mr Speaker. My question is to the Minister of Health. What progress is the government making on using patient feedback to improve the quality of health care?
Honourable Tony Ryle.
Mr Speaker, yesterday the government announced a new national patient survey will be rolled out to all New Zealand public hospitals from the middle of next year. Patient feedback is a vital indicator of how well health services are working for patients and their families, and the new national patient survey will provide invaluable information for district health boards about what they are doing well and what areas they can improve. This will add to the widely reported health target information published quarterly by district health boards, which have already played an important part in lifting health services for patients, such as seen with the big improvement in emergency department waiting times.
Supplementary, Mr.
Supplementary question, Shane Ardern.
What are the main areas of health services that the survey will be focused on?
Honourable Tony Ryle.
Mr Speaker, the survey questions will be modelled on international best practice and will look at 4 key areas. These will involve, firstly, communication, partnership, coordination, and finally, physical and emotional needs. For example, questions could include: when you had important questions to ask a doctor or nurse, did you get answers that you could understand? Or did doctors or nurses talk in front of you as if you weren't there? This information will help district health boards to make improvements to patient care on direct feedback, and this initiative builds on our Open for Better Care campaign, which challenges health professionals to be open to feedback in order to continually improve. The survey will be piloted in 2 district health boards later this year.
Very good.
Honourable Annette King.
What progress has he made on the feedback he received from the President of Hastings and District Grey Power, who wrote to him 1 month ago to, quote, plea for an elderly man to get surgery at Hastings Hospital, and who concluded the letter by saying the health goals of National must change to stop discrimination against the elderly?
Honourable Tony Ryle.
Mr Speaker, I don't have the response to that gentleman with me, but I'm sure we would want to point out to him that the Hawke's Bay District Health Board has received an extra $73 million under this national government.
Very good.
And this government is providing more elective surgery to more older New Zealanders than ever before.
Very good.
Supplementary question, Kevin Haig.
Thank you, Mr Speaker. In the patient feedback that the Minister has described, what steps specifically is he taking to include the views of those patients who don't get through the door to access the health services that they need, such as some of the poorest New Zealanders who are now missing out on accessing very low-cost access primary care?
Honourable Tony Ryle.
Mr Speaker, this survey will be specifically aimed at this stage as to those patients who've attended public hospitals, but with respect to very low-cost access, there are more patients getting access to very low-cost access practices than any time previously. We have put record amounts of funding into that, and what's even more exciting is that this government has funded free after-hours primary care for under 6s, something that was never done even during the best of economic times.
Point of order, Mr Speaker.
Point of order, Kevin Haig.
There was some interesting detail that the Minister gave, but he didn't address the fundamental question of those patients who are missing out on accessing the health services that they need. He simply said that the survey was restricted to DHB consumers. He could have given an answer that related to patients who needed services provided by DHBs and didn't get them.
Yeah, and I accept the Minister could have, but he chose to answer or address the Minister's question. The question is about a collection of feedback information from patients. You asked about what feedback information would be for patients who didn't get into hospitals, etc. He said that's not the design of the system. He's addressed the question, maybe not to the member's satisfaction, but certainly been addressed. Point of order, the Honourable
Mr Speaker, I seek leave to table the letter from Grey Power, Hastings and District. I received it, as did the Minister, where I have a plea for an elderly gentleman to receive surgery, and as far as I know, he hasn't received it yet.
Order. The letter's been described adequately. Leave us all to table this particular letter written by Grey Power. Is there any objection? There appears to be none that can be tabled. Question number 10, Te Uraroa Flavel.
Tēnā koe, Mr. Speaker, kia ora tātou. Ko taku pātai hei pātai ki te mini te mo ngā